Hello.
Hi.
Nice to see you again.
Nice to see you.
Miss TF. Can you verify your date of birth for me?
3188.
Excellent. And as you know, my name is Michael. I'm a family nurse practitioner student with United States University. We'll be recording a pulmonary exam today. Is that okay? Do I have your permission to record this and share this with staff and possibly other students? Wonderful. Thank you so much. Okay. So first part of my pulmonary examination is I'm just doing a general once-over look at her. I'm looking for any accessory muscle use, any retractions, any abnormalities of the chest wall, looking for any cyanosis in the lips. Also moving down, looking at those nail beds. She's got polish on, so can't really see that too good, but overall good skin pallor. I'll have you go ahead and put your thumbs up like that again for me. We're going to check that level bonds angle. That's a nice gap of light in there, so I don't see any nail clubbing. I'm going to go ahead and move on to going to check to make sure that your chest wall is rising equally. So I'm just going to come up behind you. I'm going to place my thumbs right along the spine at about that 10th rib, and I want you to take a nice deep breath in for me and out. Okay, now I'm just observing for equal rise and fall of my hands, and everything looked great. Okay, I'm going to go ahead and squeeze on your chest right now. I'm just going to see if I can reproduce any pain. This is checking for the costal chondritis here, so we just give you a squeeze. Any pain with that at all?
Nope.
Also, during my observation of her chest, I also want to do the anterior posterior assessment. So what that means is that looking at it from the side, her chest should be half as wide as it is looking at it front to back, or the front to back should be twice as wide as looking at it from the side, which it is. So if it was abnormal, that would be considered barrel chested. Okay, I'm going to come up and sit behind you here. I'm going to put your hair over here. I'm going to percuss your lung sounds here, so I'm going to be tapping on you. Okay. So I want to make sure I'm getting in between these ribs, and we want to get a nice resonant or hollow sound. Actually, what I'm going to have you do is I'm going to have you turn to the side. That way our camera can see this a little bit better. And we'll just start over from the top. Okay. Using something called the ladder technique, and that's where I'm comparing side to side, but must have been over a rib right there. Okay, good. All right. So that sounds good. I'm going to go ahead and do something called diaphragmatic excursion, which is I'm going to percuss out basically how much your diaphragm expands during inhalation and exhalation. Okay, so the first thing I want you to do is I want you to take a big deep breath in and hold it for me. Okay, relax. So I percussed out until I heard the change in sound. I don't know if you noticed that or not, but I'm going to go ahead and mark that. It would be on her skin. I go ahead and mark that. Now what I want you to do this time is I want you to take a big deep breath in, and I want you to force it out and hold it at that point. And hold it. Now I'm going to start from the bottom, and there's that change. So I measure these two, and that's looking to be 4 centimeters. That's totally acceptable. We would repeat this on the both sides, making sure that they're equal on both sides. Okay. While we got you back here, I'm going to move my hands around your chest. Okay, or around your back. Every time my hands move, I want you to say 99. Okay. Okay. Go ahead.
99. 99.
This is a technique
99.
called tactile fremitus.
99.
As we know, sound travels better in water than it does in air. And if this were positive, I would feel some vibrations when she was saying 99. I didn't feel anything. I'm going to go ahead and listen to the back side now, and then we're going to come around and repeat all this stuff again on the front, okay? All right, every time I move that stethoscope, I want you to go ahead and take a nice deep breath for me, okay? So let's go ahead. And out. Again, and out. Okay. Again, I'm using this ladder technique. Okay, gonna come around the side here and repeat here. One more. And again. Okay, wonderful. All right, I'll have you spin around this way here for me. We're gonna go ahead and do the same thing with the front side here. So I'm gonna go ahead and percuss out. Now your APCs of your lungs actually go all the way up here. Right over a rib. Okay. Okay, those sound good. Again, with the tactile fremitus, you'd be doing 99. So every time I move my hands.
99, 99.
Okay. We're going to take a quick listen again. Again, the APCs of the lungs go all the way up here. So we're going to start up here. Take a nice deep breath for me. Again. Okay, make them around the side. And again around the side. Okay. So now we're going to do a couple special tests. Okay, as we had mentioned earlier, that we know that the sound travels better in fluid than it does in air. So some of this stuff may seem silly, but we're just going to go ahead and play through with it, okay?
Fine.
So I'll have you spin back around here because I'm going to listen on the back side. Okay, first test we're going to do is something called egophony. Okay, so every time you feel me move that stethoscope, I just want you to say the letter E. Okay? All right, you ready?
Ready.
Okay, let's go ahead.
E, 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 E.
Okay. So what I heard throughout all your lung fields was E, which is what I expect to hear. Had I heard a E transition to a or A sound, that would be indicative of some sort of consolidation in there. Okay. Next one we're going to do is called bronchophony. Okay. Same thing. Every time I move around, I want you to go ahead and say that magic number of 99.
99.
All right. And go ahead.
99, 99, 99, 99, 99, 99.
Okay. And again, I heard normal 99 throughout. If this was positive, I would have heard an amplified 99. And the last one we're going to do is called whispered soliloquy. Okay. Same thing. We're going to do that magic number of 99, but I want you to whisper it this time. Okay.
Okay.
All right. Go ahead. Okay. And I didn't hear anything. Had that been a positive test, it would have sounded like she was saying 99 instead of whispering it. Okay. So anyway, that concludes our respiratory, our pulmonary examination. Lungs sounded great.
Thank you very
And I'll
much.
see you at the next go round.
Okay.
Okay.
Thank you.